Today, I want to talk about how we can continue to change our patient lives, but most importantly, change our colleagues' lives.
Mhm.
And what I like to do is really jump into some of the challenges that eye care professionals experience, but really healthcare professionals experience when it comes to hiring and finding the right team members in their practices. So maybe you could touch on that to kind of set the tone for the remainder of the conversation.
Whew, that's a big topic.
It's
We could have
loaded, I know.
we could have an 8-hour podcast with a lunch in between there. Um, Boy, oh boy. I think the first thing that comes to mind, just shooting off the hip here, is that you're not alone. So we got a lot of ODs listening to this podcast, and you walk into work and you're thinking like you're on an island, and you're the only one who can make decisions, and you're the one responsible for everything, and you've got the weight of the world on your shoulders, like Atlas climbing the mountain. Well, that's how it feels a lot of days. Um, you don't have to feel that way with regards to hiring. Build My Team is a company that grew out of hiring in a private practice in rural Pennsylvania in the middle of nowhere. If you know, does it work in rural areas? Heck yes. Does it work in the city? Heck yes. We got clients all over the place. The thing is, you're not alone. And so, here I am yapping on about this stuff. What does it do? What's in it for you? How does it get those results? And the the quick discussion is that we're all hiring wrong when we start using resumes. Well, why? Why am I saying that? What does a resume tell you about a person? Let's just hammer away at that. Let's chip this big old resume block away.
Yeah,
So
let's
when you're
do it.
looking at a resume, Daryl, what do you see? What do you generally take out of that?
I see name, schooling, and just history of where they worked, and that's essentially it.
Right. Now, what's that person good at?
Not much because not much is on there, right?
Exactly. So how
Yeah.
are you supposed to make a decision about what they're good at when you're staring at a two-dimensional sheet of paper that honestly, most of the time it's chock full of garbage and let's say exaggerated is well, an understatement, but it tells you nothing about the person. So then you take this person, you bring in the best resume human, you sit him down in an interview, and then they're sitting across from you as a deer in the headlights because you're the big old doctor that is intimidating. You don't try to be, but it's the nature of the situation.
Sure.
You are set up to win only when chance allows you to win. So let's tame this tiger. Let's flip this around and say, no, 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 there's a better way to do this. And the better way is to use resumes last. What
Okay.
we do, and this is all modeled after Disney, the Four Seasons, a company called Strategic Coach that I was in entrepreneurial training, executive training back in 2017. And I looked at how all these companies are hiring. And the long and the short of it is they cast the widest possible net to get as many people as they could to apply for their jobs. Then they ran them through an assessment process. Only when the people cruised all the way through their assessment process did they ever even think of bringing them in for an interview. Um, it was far less dependent upon what the resume said. In fact, they didn't look at two of the companies didn't look at resumes until they passed all the way through the assessment process.
Wow.
And I thought of that and I was like, holy cow, why aren't we doing that? Well, the answer is we didn't have the assessments, nor did we have the process. And this is arduous and expensive. So I looked at this as an opportunity for my practice to solve the biggest, most anxiety producing, miserable problem I could get my hands on. Okay, billing's a close second, but this is number one, and this is a forever problem. It never goes away in our private practices, right? Like you talk about the ultimate whack-a-mole. You better bring your hammer to the practice because that's what you're playing every day. And we were able to stop that. So flash forward, it started from my cell phone. We started emailing people. And a quick tip to your listeners, if they're emailing people for hiring purposes, it's a complete waste of time. You
Oh,
have to text. Younger people especially are checking their email 2-3 times a week. That's what they say. We all know it's not even close to that. And it's a completely ineffective medium to try and reach out to people. So we built a system that started emailing. We had to cancel it. We scrapped the whole thing after I heard my assistant talk to, I think it was 12 people in a day, telling them how to work their spam and their junk mail. We gave up. We built a text engine. So what do we do? Build My Team does all the hiring for the practice now. And the quick summary of this process is Build My Team writes a job description for the practice as to who they're looking to hire, and there's a whole bunch of tricks of the trade that the team does for that.
Can I
Then,
say one thing,
absolutely,
Michael, Dr. Neal? Job descriptions, they're the same when I look at it online. It's like
yeah,
I feel like one company comes up with one and everyone just copies it and changes out a few words here and there. Am I the only
yeah,
one that sees that, or am I just losing my mind? I mean, like it seems like no one is innovative or creative anymore.
yeah. You're right, and our job descriptions we use very specific language that gets certain types of people interested. It's the first filter.
Okay.
So we want people who are natural fits for healthcare positions, and we have all of this stuff essentially figured out through algorithms and what type of position a person is best for.
Okay.
So that job description goes live. It's published out to over 20 different job boards. Now, why so many job boards? Well, in our process, we're going to reject almost everybody. Therefore, you need a tremendous amount of candidates in the first place.
Gotcha.
The candidates come in, and first off, about half of them decide not to move forward on the assessment process. Okay. So as soon as they apply for the job, within 5 seconds, they get a text message on their cell phone. That's how fast it is. Now,
Wow.
why 5 seconds? Why is this guy so anal about 5 seconds? It's because by second 6, they've applied for their second job.
Mm.
You guys, gentlemen and ladies, hop onto the Indeeds of the world and see how fast you can apply for jobs. There's even an AI site that I was introduced to that allows you to apply for 5,000 jobs with a couple button clicks. This is how bad it is right now, and that's
Wow.
only going to get worse.
Yeah.
So they get a text. 20 minutes later, they've gone through our entire assessment process. We start off by measuring their mindset, and we're looking for people who want to work in healthcare. They come to the table with a healthcare mindset. They're a team player. They're grateful and appreciative. They've got initiative. They really have a helpful heart. They like, enjoy helping people. They have
Yeah.
honesty and integrity, etc. Now, they have to imagine a big old funnel. So they have to pass that in order to move to the next level.
Okay.
Next thing we do is we're assessing their speed of learning. I got news for you, folks. You have a problem with people who are too smart in a healthcare practice, and you have a problem with, well, how do we gently, politically correctly say this? Boat anchors. Okay. I mean that in the nicest possible way. They're wonderful people, perhaps, but they're not designed to work in a healthcare practice.
Right.
Their strengths and talents lie elsewhere. The genius is they're really smart people. They get bored in healthcare. They move on. And so then the worst case for you is you hire a super smart person, you get all excited, and 3 months later they quit. There's a sweet spot there, and we're able to identify that. Next thing we're looking for are their strengths and talents. And this is one of the key components of the Build My Team process. We aren't looking specifically for experience. What we want, and that's a little bit of a trigger for some listeners, but
Yeah.
we want people who are naturally talented and have the strengths for the position that you require. Okay. So what I mean by that is, let's say somebody comes in for a front desk position, which we've all hired for a million times. Do you think that you need somebody with a low stress tolerance or high stress tolerance?
Hi.
Your eyes just went up like crazy. Yeah, there are a couple exceptions. There are some really nice mellow practices. There's only 2 left in America. Those folks can have a low stress tolerance. The rest of them need basically crazy stress tolerance.
Yeah.
We have a whole bunch of these not only characteristics but strengths and talents. Are they warm and friendly with patients? Can they follow procedures and policies consistently? Do they handle details and paperwork? Because who wants a team member who can't handle details and paperwork?
Right.
They could be the nicest person in the world, but all you're doing is you're setting up your audit risk to be ridiculous, right?
Right.
And we're looking for people with strong follow-up. That we have a whole bunch of these characteristics. I could go on and on, but we have pages of this information about these people.